My name is Iman.
I'm Malik.
And the topic we chose for our health literacy project was asthma and the Philadelphia Black male youth. Oh,
I think we'll do that way to her computer.
Oh.
It's just turn on this. Sorry guys, my fault.
Who's out there?
If anybody's watching. Don't touch this. Oh my gosh, look at it. It's like a okay. Matrix. So I think actually that's not at all. I want to find your presentation, which is in Safari. Wait, click once just to see it. Okay, we're good.
All right. So again, the topic which you chose is asthma and the Philadelphia Black male youth. So just to give you a little bit of insight on Philadelphia in general and health literacy in Philadelphia, Philadelphia is considered to be the poorest big city in America. 26% of Philadelphia is in poverty, and 43% of Philadelphia's population is African American. So when we looked at health literacy in Philadelphia, we saw that a lot of major concern was around heart disease, cancer, and diabetes, especially in the. So just to talk about asthma in general, 1 in 13 Americans have asthma, and asthma contributes to 10 deaths per day. And Philadelphia actually ranks 4th worst in asthma prevalence. So these statistics were like crazy to us. We saw this and we were like, we have to do asthma in Philadelphia, especially with the Black community. So then we saw that 13% of children in Philadelphia suffer from the disease, and that the Black youth are 9 times more likely to be hospitalized due to asthma. And at the same time, as of 2015, African American children have a death rate 9 times that of white children due to asthma. So, and at the same time, we also saw that children, in boys, asthma is more prevalent in boys than girls. And then in adults, it actually reverses. We're not sure as to why, and that's something we'd be looking to explore a little more. So according to the Asthma and Allergy Foundation of America, to reduce the risk of death from asthma, it's important to control asthma by taking prescribed medicines and updating care providers if symptoms are occurring more than twice per week, avoid or reduce exposure to asthma triggers, learn the signs and symptoms of asthma, and have an asthma action plan.
So the risk factors that actually do contribute. So the risk factors that contribute to asthma are going to be as followed. You have poverty as a major one, the lack of health insurance, poor air, pollen counts, smoking laws, access to specialists, quick relief medicines, and long-term control medical use. So when it came to poverty itself, like we had previously said, Philadelphia did rank 3rd across the nation. As you guys are probably familiar, if you guys are probably familiar with the Philadelphia area, you do notice that there's a lot of sections that do have very poor rental housing. There's a lot of housing that is near highways, and obviously that's going to be cheaper. So the people that are living in poverty will tend to lean towards these areas to live in because that's what they can afford. The inability to pay for treatment, I mean, that's a huge, I think everybody knows how the medical system in the United States works. It's pretty bad. A lot of people are in medical debt, and already being poor, it's not really easy to have to constantly go to the doctor and stuff like that when you don't have aid. So when we were looking into our audience, like the African American community, these were like one of the top places that have the majority, like African American population. So these are probably definitely areas that we're going to focus on. Some of the top 3, I was like Olney, I guess. Olney, Olney, just 49% African American. Got the Northern Liberties area, West Philly, Northeast, and Frankfurt. I mean, the list: North Philly, South Philly, Northeast, and Port Richmond. That's one of the lowest ones. But anyways, as far as our audience, we do have like 2 main audience members that we do want to reach. So definitely the Black male youth with asthma, and we're looking at maybe ages under like 20. We might lower that, like because when you're kind of 20, you're already kind of grown technically, but so it might be down to like 16, 15 maybe. And just like looking into like their lifestyles of these like youth, what we kind of saw that, you know, most of them go to school. Some of them might participate in after school programs. That's also like another thing with like poverty, is like schools don't really have much after school programs for students to participate in, even though they might like to. Anyways, besides that, you know, they might just go straight home, you know, go outside, be in the community. Most youth do that. If not, they're probably just inside, you know, at home, and you know, but still constantly surrounded by like the bad, you know, the air quality and all that stuff, poverty. So it's all around them. And then as far as like the other audience members that we definitely want to reach is like the parents of the children with asthma. So, you know, most of the parents in these communities are only working like low paying jobs, such as like drivers, managers, like, you know, in customer service, all that stuff, which, you know, the minimum wage in Philadelphia being like $7.25, they're probably not making too much. An example that we did look at was a woman, a mother of two, her name is Ronnie Jackson. She's 45 years old and she's a West Philly mother, has a 2-year-old and an 11-year-old. And, you know, she's in the process of getting divorced, so she's a single mother right now. She makes less than $24,000 as a home care worker, and which technically is probably well, and this was also published in 2017, so you know, inflation and stuff like that, but that's only a few $1,000s above the poverty line. And you know, her rent and utilities basically run to like $700 a month, and her car payments eats a lot of her money, so there's really a lot of disposable income that she has to like really, you know, help her kids that she really does want to help. Or she also, they might not have the resources, the time, or the knowledge on how to best keep their children, you know, healthy. So that's like a big, you know, a big concern for us. Something we want to touch on. So yeah, the minimum, we're gonna just talk about like poverty itself. It's like the minimum recommended amount to spend on food in Philadelphia is $12 a day, or like $378 a month per person. And the average rent for like just a studio in Philadelphia is around $1,000 like dollars. So that's already like just, yeah, we'll go into it more, but it's already a lot. So this was interesting on like basically how much it costs like the government and like to, how do you say it, sustain like asthma, to fund asthma. Mm-hmm. So for a single person with asthma, it'd be the average cost of them per year is like $1,266, and I mean, divide months, like that's the monthly, weekly money that needs to go into, you know, supporting somebody with asthma.
So we kind of broke down kind of just like if somebody was working a minimum wage job and they were working, let's say 40 hours a week, the entire year, how much they would be making. So before taxes, they'd be making $13,000, $920, and divide their average rent for the month as decided by Philadelphia, take away that they would be in debt with everything for food and everything by $3,000. Now, they haven't even subtracted medical costs or anything. Adding that, you'd be in debt for $6,000. And this is not even, again, including utilities, any taxes removed, any transportation, nothing.
So yeah, in Philadelphia, in Philadelphia, the poverty line basically for a family of four is like $24,000 or less. So that's kind of insane. I mean,
basically, on after all of that being said, is prevention rather than treatment. A lot of the programs right now are focused on treating asthma and providing the African community with access to inhalers and medical care. But the problem is that we want to focus on preventing asthma in general. So basically, we're looking to educate people on what causes asthma. Not just that, hey, take the inhaler, but that these living situations are causing you asthma, and basically enabling them to ask for change, basically. You know, so it's not just that we're looking to, you know, educate them on health itself, but we're looking to educate them on larger aspects for them to ask for better situations and better life in general.
So talking about touch. So we look at the child with asthma, and they have a parent, and with their parent, they also have in the neighborhood, the local shops, and friends and family members. If all these people do not understand what the child or the person with asthma is going through, then they won't be able to help or be able to offer any kind of situational happenings. So if if the child was in school, and they have to understand that there are different parts of what's happening in the school based on their surroundings. So you have the Board of Education, which is going to understand like how can we either reduce the amount of kids in a classroom to then be able to have a space where the kid is able to thrive and be able to be a little bit more active if they're in a situation where they're going to different programs after school, and be able to talk to different people who understand the problems that the child is going through. So we have government and community organizations and environmental research. With environmental research, we'll be able to get the information based on what's happening in this child's surroundings, like how Shelby was talking about earlier, that most of these in low-income areas, closer to highways and closer to places that are not really conducive to the betterment of health and their well-being. Yeah. So moving forward, we'll be figuring out how to, whether it be through community events, meetings, or speeches, talking to residents of the communities of the top 3 communities that we had listed earlier. Photo ethnography, just doing photo research and being able to see what's happening in all of these different regions. So like if they're being built, or if there are more situations in which the child is not being able to go outside because of pollution, air pollution, or different ways of harming them, and reaching out to doctors, school nurses, and environmental scientists. All these 3 different people be able to have different resources based on school nurse and talk to them about what the average kid is in the school. They'll be able to, that will have different information on what's happening in a more global sense in the area, and environmental science will be able to talk about the more larger area in Philadelphia. Interviews and surveys, we'll be able to talk to different people who either have had asthma or have asthma, not had asthma, but currently suffer from asthma, dealing with asthma, and the gender disparity, seeing between a male and female counterpart dealing with how they deal with asthma. And then look at other cities and how they were able to either prevent it or treat the people.
I'm going to give Monica just a minute to maybe gather her thoughts. Oh, let's not waste time.
Oh, I actually was really impressed by all the asthma facts that you guys presented. Some stuff I didn't even realize. So I think the one thing that's popping out to me, and I think it's a clarification question for you guys of where you're really going with it, because we actually can't prevent asthma from developing per se, because some of it is genetic. There's other parts that, you could be in the most perfect environment and still get it. But when a little bit about that. And also, I heard a lot about, maybe just because you don't know the terminology, but prevention of exacerbations. Is that really where you're aiming at? I hear a lot of education about managing the environment, all these things for the kids who already have asthma. So it sounds like prevention of exacerbations, which would help drastically those healthcare costs.
We're crazy where it was like, Black children are 9 times have asthma, and clearly those are because of and so we're looking to kind of try and reduce those just by knowledge, by education of hey, you're able to reduce these risks if you're living in better housing, if you're talking to local government officials about smoking laws, or so I don't know if that makes sense at all. That answers your question.
I think that what we're trying to figure out is how can we facilitate something in which the community can then push forward.
Right. still hearing two messages though. So the question is, are you guys really going to focus on trying to reduce the risk of developing it? Or are you going to really focus on like more management of when you already have it, how do you reduce the risk of an exacerbation? So that's just a question for you guys. You don't give me an answer right now. Just think about it because you're either talking both ways. There's definitely things though that I think kind of go, like if you address smoking and all that kind of stuff, it's going to help both sides. But I think a clearer message would be helpful just so you can see your direction. Because then also like it also depends on what population, like age ways you're going for. Because I heard parents, but then I also heard like 15, 16-year-olds. So like if you go with the parents, that's one side. I think you guys have a really good grasp of that. If you go with 15, 16-year-olds developmentally where they are in their life, they should actually be starting or getting proficient in managing their own healthcare. And so that could be a completely different angle of like, hey, you're 16. You're almost a grown-up. In 2 years, you're going to be, like you said, 20, they're kind of adults, right? Yeah. In 2 years, you're going to be a legal adult. You know how to manage your own conditions so that you don't have all those healthcare costs piling on you once you become an adult. So that could be another really interesting angle. I kind of see popping up, but I wasn't sure what your focus was on that either. So another idea for thought in terms of that. But like as a person who loves environments, it's like the idea of addressing the environments that people are living in is just, that's such a big one. And I've been hitting that a lot even in my older adults lately of going into homes where the reason why they're having so much problem breathing is because they know there's mold and all sorts of stuff in there. And we're trying to figure out how can we fix it.
And that's like part of it is we want to educate parents. Like, this is what you guys, these are your resources you have, because a lot of it's like, they don't know what resources they have. Like,
Yeah.
who do they talk to if they have mold? Who do they talk to if, like, air quality is low? That's like, this is who you make.
Definitely identify like the resources, like all the different parts that need to happen.
Yeah.
I'm just kind of curious what you want to do with it.
Yeah.
Because it's a big problem. You've got like 4 or 5 that you go in. And some of them, like, to be honest, I don't know how much we really do focus on like helping a teenager become their own healthcare, like I gotta take care of this myself, or
There's more feedback.
no. Thank you guys. That was great though. A very interesting
I have on a Zoom link.
very interesting angle though. I like it.
1, 2, 3. Thank you guys. Yeah, my Instagram is dry.
One of my students is here.
So you guys are going to be speaking into a microphone, so whenever someone's speaking, you guys can just pass it to the mic, okay? Don't worry.
It's just so that people on Zoom can hear you. Otherwise, we can't hear a darn thing.
Yeah.
One person is watching, and then other people will watch later. But in the past, if we don't have it, like
yeah, so
you
try to
see this, and no one
make
knows
sure you're
how.
standing in front of the to the right. Is that Google Drive?
Who's starting? So we're gonna constantly be like, switch the microphone. Hey.
Oh boy.
Oh. There's so much in my hand. I'm stressed.
Wow.
So maybe 2 of you could stand here and 2 of you on that side, just so that other people.
Oh my god. Oh my god.
Okay.
Yeah, you have to get it.
It's fine. It's good. Do a click just to make sure that the slide advances.
Yep.
Okay.
You're good.
And I'm going to be distracting you by taking photos, but try to be.
Whenever you're ready. All right, take it away.
All right, so I'll start. My name is Gianna. Emily. And starting from the very beginning, us as a class, we developed a bunch of different things from our notes we took away, like stakeholders, just basic facts. We ended up putting those together and kind of coming up with like situations. So after we had done that, and we decided to split them up into all different focuses. And the focus that we came across was daily life empowerment. So just looking at these really quick, some of the stuff that we developed was like designers having specific doctor's offices for non-English speakers, stuff along those lines. So then here we are with our logic map, kind of going through like the next process for us. So our big purpose, once we had daily empowerment, we decided to do finding out what exactly daily empowerment in health literacy is. So then we started to gather information online from professionals. Target audience. So when we were figuring out what target audience we wanted to do, we kind of broke it up where each person developed a different age group, so to say. So like Dan had researching young adults and did a little bit of a focus on physical therapy. Had non-speaking Americans, Jolie had older, elderly people, and Emily did friends and family. After we went through that whole process, we then concluded doing young adults between the ages of 12 and 18. We then, after that, we were developing like a rosebud thorn, kind of coming up with what exactly we are, like the goods, the bads, and the, neutrals of all the different topics that we were coming up with. We were kind of like still brainstorming. We kind of were like, okay, we think that young adults is a stronger thing for us, but we still were, comparing why young adults, or why elderly people could be an option. We were still weighing our options until we came to young adults.
Can you just keep the clicker? Yeah. All right. And for our topic overview, when it comes to health literacy, so we found that there was like a big gap between children talking to their parents about things having to do with their health. We found that, like, I did research with the elder community, and like that's one of the biggest demographics, but children is kind of like a neglected demographic just because like they don't have much of a voice like at that age. But just talking about how there's like an educational barrier there, and a lot of like kids and adults sometimes try and like rely on stuff like WebMD or the Mayo Clinic when it comes to like talking about their symptoms or researching their symptoms, and like that's not always the best resource to go to, obviously. And in children and young adults, it's uncommon for them to talk to their parents or guardians about like uncomfortable situations, and that's kind of involving like puberty or mental health. It's just kind of like an uncomfortable conversation to have. So our goal is to kind of develop that conversation in like a comfortable way. For these reasons, our goal is to, normalize the hard conversations in this age group between like 12 to 18 before they're young adults with parents and caregivers, so that there's some kind of conversation between them. Since our target audience is between 12 and 18, we're focusing on the Roxborough High School and the Amy Northwest Middle School. And later in the presentation, we kind of have like a breakdown of the demographics, but we think that that would be a good target audience to play off of. So yeah, Amy Northwest Middle School is located on Ridge Ave, and as you can see, they kind of have a breakdown of the population. It's pretty small. It's only 259 students, but we're getting all kinds of like walks of life from both of these schools, so we thought that it would be like a good schools to reach out to for both of them, because we're kind of we can get different perspectives from people and different like answers about like their home life and what their relationship is with their parents as well.
So our target audience that we're going for is 12 to 18-year-olds, as well as the parents and guardians, the 12 and 18-year-olds as well. To go along with stakeholders as well, when we did the stakeholder map, we talked about teachers, staff, and administration, parents and caregivers, as well as friends and family, occupational therapists, and other medical professionals, as well as the members of the community, going along with like where they're located and all that, and school member boards. So some obstacles that may come up during our research and design are the initial start of conversation between children and their parents and caregivers, religious or cultural views and beliefs towards health literacy, and yeah.
Okay, so the other day we were trying to formulate different ideas for different deliverables that we could possibly show to the children to kind of normalize the conversation. So we started out up at the top, we wrote how might we statements such as how can we normalize conversations between children and their parents, and then also how might we educate low poverty students in health literacy. And down the left, we came up with a few different categories for the series that we might come up with. And these are book series, symptom cards, an app, and a wild. Can you click? Yeah. So in the end, we came up with a whole series of different options. And these include illustrated book series, which we can later formulate to include mental health, puberty, health ailments, sexual health, and healthy living. And another option we have is symptom cards, where the child can, in order to start a conversation, they can use these symptom cards to show their parents or whoever's in charge of them to make it a little more comfortable for them. And this can provide an easier way of communicating their symptoms with their parents. And then the third idea that we have is creating a smart app where the children and the parents are able to log in, and the child will be able to log in what they're feeling that day, and later on their parents can later log in to see what exactly they're feeling in kind of like a secretive way, but it'll be helpful for the children to feel like more comfortable talking to their parents if their parents know what's going on. These are just the sources we came across in our research. Thank you.
I actually appreciate you guys putting deliverables on at the end because as I was watching this, the first thing I was thinking is like, are you guys going to do like general health literacy and helping them learn to know what they should talk about, which actually could still be a kind of a cool angle of like, or were you guys planning on going something more specific? And the first thing I thought was like, well, mental health or like the exact topics that you guys popped up on. They do. Right. Yeah, absolutely. I mean, I think you could go either way, like just general, like what kind of stuff, like when is something a problem, no matter what it is, and how do I approach it with people? You could go that way, or you could go more specific into one of your topics. You can't really, in my opinion, you can't go wrong with either one. I don't know how you guys feel.
Yeah. Plenty of time to talk to them.
I had similar thoughts. Where I appreciate the idea of approaching it broadly, because that sort of could be a good opportunity to show the scalability and the sustainability of your idea in terms of its lifespan and how you can continue to iterate and evolve as newer topics come up, like opioid crisis, drug use, things that we don't even know yet about, like maybe, anyway. So I appreciate that, and I feel like, oh, that's clever in the way that you're approaching that. But then I also think about it from an execution standpoint. Are you trying to say too much in one semester? And so I think as you guys start to investigate those 4 topical like categories that you came up with, you will, and with Renee's help, obviously, will start to zero in on whether or not that broad approach, like having a booklet for each one, is appropriate, or you know what, let's focus on sex education because there is maybe you'll find a statistic that is like all these kids are having babies at 15, and that is a point of intervention.
Yeah, I agree. Yeah, I think like I was going to say the same thing. Like, and part of my comments are more about how you presented, because you guys did a good job. You presented everything that you needed to. But I think if you can integrate the research you're presenting in front with why you landed on those solutions a little bit more clearly, some of these answers might, or some of these questions might answer themselves, because a lot of your research in that beginning phase, did focus on puberty being an uncomfortable topic that parents are not I think you even had some research that kind of pointed to the fact that this is currently an uncomfortable topic, and with mental health situation, I think you had some current research too. So as you move forward, just make sure you're constantly like connecting that research that you're doing to what you're doing in the deliverables, because that will help you focus it. Okay.
I think it's actually funny that this was the topic right after, because one of the feedback I gave the group just before you guys was the demographic that you guys are going for is when people are learning about how to take care of their exactly. So just, no doubt. But then also popping up. I gone this way. When I heard daily life empowerment, and they're severe, but being in the grocery stores, we see out and about. One is disempowered in that age, especially. And so if you really wanted to go completely off the wall from where you guys are headed, that might be an interesting demographic to look at, communicate with their parents.
I also wanted to just comment, looking at some of that policy map research to kind of target the location you were going to focus on, and we're thinking about high schools and libraries and things like that. I know we talked a little bit about libraries, which didn't come up, but as you were looking at those demographics, you guys presented it as like a mix, but it actually was really heavily African American students. So you're really going to have to, maybe it's, the focus, since you're thinking about cultural and that type of situation with parents, you're really going to have to target that demographic in that, with that school those schools you're pinpointing to.
Very small, specific things that you need to decide on in order to carry forward in general to make it work. I think it's a great idea in general. Like when you put daily life empowerment, I was like, oh, that makes me so happy.
Some of those, like, I wish you cropped in on some of them, or you can even redesign that slide, to in the future so that we can actually see those connections. Like Gianna read one of them, but we want to know where don't just tell us what you did, but show us what you learned when you did it. Okay. Yeah. Right. Thank you.
I'm going to make a note to the people online. If you have chat box. Thank you guys.
Jolie just can't put that I know. Oh, you're so much taller. Look, they're all the same height and you're so tall. I didn't know he was that tall until we put him in this group. This is pretty good. This is like Christmas card. I know, it's so cute. Hey, that's cute.
Great, thank you guys.
Thank you. Yep. Thank you.
Bye. That could continue on their ideas if they look at you guys.
Yeah.
I'll follow up for next semester, I think.
So the ideas are good.
Is Carly on that? She is. I think she's kind of.
I shot her an email. She was wondering if she didn't attend all.
I told her the same thing. You pop in and out as you. She might be on right now, but dealing with something else and then popping in and out.
I don't have my
I think Jade was supposed to join us as well. I think one of the other girls, Jade. I think everyone else probably will listen later.
Hi. So we're gonna have you log in here. Here's a clicker. Here's the microphone.
Oh, what?
You have to pass it around.
Oh, okay. Are you serious?
I'm super serious.
Really?
Yes.
Last time.
We're gonna Zoom. OT.
Oh my God! How cute!
They can hear you.
This is gonna be so ridiculous because we're so sporadic of whose talks.
Well, maybe some is someone has the microphone in the middle. Can you still see this screen? I don't see that one, but I see that.
Oh, that's sorry.
But they've been seeing the visual up here is better.
Sorry, everyone. Now you're good to go.
Okay. Hi. Addie.
I'm Kayla.
And I'm Carolyn. And we're doing dementia in Hispanic communities of Philadelphia. So health literacy and how is Philadelphia affected? Health literacy affects 1/3 of adults in nearly 90 million Americans in America. The cost of low health literacy in the U.S. economy is about 106 billion to 238 billion annually. It's associated with lower income, lower education, and older age, and people are most likely to get health information from radio and television, friends, family, and social media nowadays. So how does this affect Philadelphia? So Philadelphia there's nearly 400,000 Philadelphia residents. Roughly 26% of the city's population live below the poverty line in 2017. They have low education. 19% of high schoolers drop out. Of the 25 largest cities, Philadelphia ranks 22nd in college degree attainment. We have a large population of 65 and older. 65 years and older is projected to increase faster rate by 13%. And we have a growing English as second language. 1,600 English learners attend Philadelphia public schools. That has risen from 1,200 just 7 years ago, and all of these factors lead to issues with health literacy.
So when we're talking about dementia in the context of Philadelphia, so just some statistics that we found particularly jarring that really made us want to tackle this issue is that about 280,000 seniors above the age of 65 were diagnosed with Alzheimer's in Pennsylvania in 2018. 1 in 3 seniors will die from dementia and Alzheimer's or related factors. And 18.4 billion hours of care, valued at over $232 billion, are provided by family members or other unpaid caregivers. So that all of that time is beyond the nursing homes or other paid care. So when looking at the role of the caretaker, we found a definition of caregiving that refers to attending to another person. Includes activities of daily living, daily living, so things such as paying bills, shopping, and using transportation. Obviously, dementia care is something that's more intense than regular caregiving. Obviously, with a more severe disease comes more time that's necessary with the patient. So dementia care is reported to require about 27 additional hours per month than hours of care per week increased from 45 hours in 1999 to 48 hours in 2015. And while that only seems like 3 hours, regular general care for non-dementia caregivers decreased from 34 hours to 24 hours. So although it's not a large change, the other caregivers are going down in the amount of time that they have to spend. This leads to 46% of dementia caregivers being classified as a burden, and while they are not saying specifically that this is a burden to them, this is shown by the Burden of Care Index, which combines the hours of care with the number of ADL tasks, the activities of daily living, as we talked about before, and that turns it into a single numerical score. As well as 59% of family caregivers of people with Alzheimer's and dementia recorded their emotional stress as high or very high. This goes without saying that it takes a major toll on the family. All of this being said, 45% of caretakers caring for someone with dementia report their job to be very rewarding. One of the people who reported her job to be very rewarding actually goes to our school. Noelle Kukuza, she's an activities manager at Gwinnett Healthcare and Rehabilitation Center. We interviewed her, and this is one of the quotes that she said. She said that throughout her interview that it's such an emotional job and that she feels such a range of emotions, but her strongest emotion is that she's happy that she's doing something good for them and that it truly has changed her life working there.
So after gathering all of this information, we did have some preliminary questions based on dementia purely itself. So we wanted to know how big of an issue it was. Specifically, how does it affect communities in Philadelphia? Most importantly, what are the costs of caring for someone with dementia, both in a sense of actual paid care and unpaid care? What are the living conditions like for the people in these communities? How do the communities support each other? So what is the neighborhoods like? What are the resources they have available? That goes into what is currently available for care. And then are there any specific groups that are more affected than others? This kind of leads us into our specific group that we're going into. And most importantly, what can we do? Because there's a lot of different routes you could take to get to where we're going. And we just want to know what is the best way to go about this.
So kind of backtracking off of that, talking about the demographics, we found our demographics in Philadelphia with the Hispanic community. So these two maps, we're just starting off generally. This is a map of Philadelphia with highlighted regions. The blue is highlighted regions where the population, with a population of Hispanic residents. So the dark blue represents where the population is greater than 14.3%. The medium tone blue is between 3.83% and 14.3%, so that middle ground. And the light blue is 3.8% or less. So obviously a very dense Hispanic population. From that, we can see in the second map which areas there's a high percentage of the population that has English as a second language. And while this doesn't necessarily mean that it's only Spanish, we can see the overlap of where the darkest regions are. We pretty much can assume that in those Hispanic areas, it's going to be Spanish. So the dark red is 6.9% or more of their population speaks English as the second language. Pink is between 1.7 and 6.9% English second language, and white is 1.6% or less. From those two maps, that helped us to find where the issues of health literacy might be most prolific due to factors such as cultural barriers, language barriers, obviously English second language, lack of awareness, and limited resources, which led us to our second set of maps. So this next map is showing the population of Hispanic people living in poverty. So the dark red is 24% and above, the pink is between 5.4 and 24%, and the white is 5.8% or less. This second map then shows us where the percent of Medicare beneficiaries are diagnosed with Alzheimer's or dementia. I'll just, obviously it's, yeah. So it's pretty much just, yeah, exactly. It's pretty much just almost 11% of those on Medicare have been diagnosed with Alzheimer's or dementia in Philadelphia. So these two maps we can draw where the burden of cost is most going to affect people. So if almost 25% of Hispanic people are living under the poverty line and 11% of seniors on Medicare are diagnosed with dementia, there's obviously an issue of overlap there. When looking at care for those, this is helping us to zero in on North Philadelphia. So we found the highest Hispanic population we wanted to zero in. And the first map is showing us the orange dots are all of the care centers. Just a more detailed look at those, we see that they are more generalized care. They are also children's hospitals as well, but there are none that are specifically for senior citizens, let alone senior citizens with dementia. There's also a really interesting statistic that said that national surveys have found that approximately 25% of dementia caregivers were part of the sandwich generation of caregivers. So they're not only caring for somebody with dementia in their home, but they're also caring for children under the age of 18. So that also is affecting, that's also affecting the people in these areas.
So from that comes our problem statement. The role of a caregiver is often thought of in the sense of a medical professional, but what happens when that role has to be filled for free? It falls back on the family of those struggling, compounding the grief, financial burden, and mental health of the family member who has been deemed the caregiver leads us to the population we are hoping to provide resources for. So these are our research strategies in the context of Philadelphia. First, we started with the stakeholders map. We wanted to be really broad and just basically find all the connections that we could find. Patient with dementia, from the patient all the way to hospice, funeral homes, big pharma, nurses, providers, politics, churches, basically just anybody that they're connected with and who could possibly be indirectly or directly affected by the person with dementia. So this is a little bit more in depth of our stakeholder analysis. We kind of broke it up into professionals who have really high power to change things and then kind of a low interest of helping us change things. And then we have our drivers, which are basically the reason why we want to do this project. And have a really big interest in helping and a lot of power to help us change it. And then we have our bystanders who have kind of a low interest in helping and a kind of a low power to change, but they're also still directly affected by this, so whether they realize it or not. And then we also have our helpers who have a really high interest in helping, and we can really utilize them in support of whatever we decide to do in the end to help us support the drivers.
So from that, we have 3 different stakeholder personas that we want to face and base our research around. So this is Mateo. He's 81. He's Puerto Rican and lives in Juniata. And he's been getting more and more confused in the last 2 years of his life. Sometimes it's little things, but other times people, places, things. One of the main things that he does is that he gets violent when people attempt to help him because he can't recognize them. And he still believes that he on his own is not necessarily accepting of the disease as a whole. He still enjoys visiting his community centers and attending services at his church, so he is still becoming part of his community. His wife is worried that he's going to get concerned, given that they believe that this is a part of him growing old. His daughter thinks that a large decline is going to happen, but does not know how to help him realize his condition, and he's very reluctant to get the help because of his gradual memory loss and his not wanting the help. So next we have Daniela. She's 43. She's Hispanic and lives in Fairmount. She's the only child of 2 parents, and she has 3 kids under 16. Their ages are 16, 12, and 9. And she's a single mom. Her father passed away 10 years ago, but her mother is still living, but she's now showing signs of rapidly progressing dementia. Daniela works 2 jobs to keep her family afloat, given that she's a single mom and has 3 kids. But she can't afford to get her mom a caregiver 24/7, let alone just for a little bit of time throughout the day, maybe 2 or 3 days a week. She does make use of after-school programs to help kids just have alone time and get her the time she needs, but it's not enough. She's now taking on caring for her mother and has moved her mother into her house. She's struggling to cope with the changes and grasp the fact that her mother is now not the person she once knew, and she does not know how to handle someone with dementia, or let alone know if she's giving them the right care that they deserve. And then finally, we have Robbie. He's 14. He's Puerto Rican and lives in Feltonville. English is his family's second language. Robbie's grandfather doesn't recognize him anymore, and no one really understands why in this situation. They don't really understand what doctors are telling them, and Robbie, given that he is the best English speaker out of what's going on, he uses some handouts from the doctor, but not when they can. After he tells the family begins fighting sort of a in the family. He doesn't really understand what's happening, and he doesn't know how to approach his family with his feelings. So just some generalized problems that they may have. Mateo, dealing with his own dementia, violence towards caregiver and people, and moving past growing old. We found that a lot of people in this community believe that dementia is just a part of old. More than just a part of growing old. With Daniela, proper care, feelings of being alone, sandwich caretaker she's in. And then with Robbie, English as a second language, conflict within family, grief at a young age, and lack of
In the wire, and I'm watching the audio cut in and out.
Oh my god.
Be careful.
Okay, I'm sorry.
Yeah, you're good. Like you're not. Yeah, I'll just double check that it's plugged in right.
It's all good.
That's a good. Oh, okay.
Oh, okay. Cool.
Keep an eye on that.
We're good.
Okay. Some of the burden of those caring for someone with dementia, and how might we give coping and self-help skills to family members struggling with grieving disease. Just combining those questions with programs and services, partnerships, as well as, you can go to the next slide, events and technology. We came up with a few ideas, and a lot of them have a lot of overlap just because of the, I guess, specificity of the disease. A lot of them have a lot of overlap. So things such as an app to analyze / log everyday problems, the same as like a meditation app. So just seeing how we can provide these resources.
Our group hopes to create resources for caregivers of people with dementia, as we have found that it is not always a possibility for low-income homes to pay for 24-hour care, and that the responsibility often falls on someone in the family. More specifically, we hope to fill the need in Hispanic communities due to a lack of recognition and access to health literacy.
So from that and our How Might We chart, we had a list of opportunities that we feel like we may be able to go into. So the first one was a network for caregivers to communicate problems to one another, offer advice and support, kind of just making sure that no one feels that they're completely alone in this area. Technologies for translation for those who speak English as a second language. Organizational components for those struggling with time management and how to properly manage busy schedules to stay on top of their time while caretaking. And information graphics to ensure caretakers are given the best possible care that they possibly can.
And this is just our logic model, just basically an outline of where we are right now and the contacts that we have made. So we've made contacts with people, the director of Jefferson Nursing, the director of social work at Jefferson, Noel Kokoza, and personally we have somebody I know, their family has experienced something like this, so we're going to be in contact with them. We're going to be doing a lot of interviews, observations, and then if you go to the next slide, we just basically want to have a research summary, brainstorm together, do a lot of user testing, and then analyze our results at the end. So, thanks. Presentation.
It's okay.
we're not really sure what's going on. Oh, I think maybe we're working on Bluetooth, which is half the issue too, I think. I don't know. There are 2 OTs in our department that I think I should send you to. Let me ask them first to make sure they're cool with that. But our chair, Dr. Pearsall, does a lot of dementia programming. And I think that you guys would really benefit from talking to her, especially since caregiver burden is one of her areas of focus. And that's what I hear coming out of here. And then Dr. Martinez, she also works with older adults, specifically community-based health literacy, decreasing the health disparity in Hispanic populations. So let me email them. I'll email them, make sure they're cool with it. I'm sure they won't have a problem, but let me just check and then I'll give you guys their names. That's our healthcare, much to say, wouldn't go into those neighborhoods either. For safety purposes. There's definitely certain parts that are not, they're kind of, I hate to say blacklisted, but for safety reasons. Not so much in Nix, I've been in those neighborhoods, but then it's also, do they have the right health insurance to get the care out there too is the other issue we run into. I think the other things, I know we're running short on time, that popped out, I just wanted to give you guys a better word for violent. I think what you're describing, we call it combativeness, or combativeness or agitation. Is just a more accurate term for what you guys were describing. But definitely an area of great need. Like, you guys were speaking right here to my heart the entire time. And I think you're on the right, definitely on a really good trajectory and where you're going, because definitely the sandwich generation caregiver burden is so high with our people who care for their loved ones with dementia. It's a huge problem that we're, in my field, working very actively to try to fix and address. So it's a good one. Thank you guys. I'm gonna try to reboot this. It's like a Bluetooth thing.
One, 2, 3. And then wait, I've taken everybody else's photo with this. Perfect.
Bye, thank you. All right, testing. Please keep the audio. Please. I don't know.
So it gets not the same.
Right. Can't hear us right
I don't know if that was just like
now. I'm not sure if it's the Bluetooth or like I did notice that the antenna was bent in her pocket.
let's not let them do that.
So, but this part's okay. I don't know. Carly was telling me she was catching about 90% of it. She was telling me it was cutting in and out. And that's why I started watching the talking. Okay.
I don't know if I shoot them off too fast. I got my. Do you have the schedule open by any chance? Can you look at it on Slack? I feel like we're behind. Okay. I'm trying to stay super. I was like really happy with the presentation, but I was also like, so we've got a little orientation for you. A clicker.
Oh, professional.
Microphone so that people online can hear you guys. Just be careful with the wire and don't put it in your pocket because we think when the antenna is not straight, like I'm watching the talking to make sure it's working because it is working on Bluetooth. And so I understand from the one person we do have on that's been cutting out a little bit, but otherwise they can't hear you at all. So, you know.
Who's starting?
You.
Oh, yeah.
Okay.
You might give one person the charge of the clicker, just because now that you've got this microphone.
I got this microphone. A burden.
Sorry.
Me too.
I'm a burden.
Shut the fuck
Try to organize yourselves. 2 people at one time, maybe.
Get. Can't see.
All right, so.
Oh.
Yeah, just go like this if you want me to.
All right. Should I? Is it like time? Is my mic working? Is this thing on?
Don't you guys
huddle towards.
This happens when you get part
Do
way.
we need to,
You get
like-
all the instructions.
Do we need to like latch a leash onto a belt?
Okay, cool. I'm glad we have this figured out. Okay, so for our OT concept presentation, we have decided to go with the problem statement. How might we help people working night shifts and weekends manage their high blood pressure? We found that through our research, high blood pressure is a leading chronic health problem among Philadelphians, and it can lead to other health issues such as stroke, vision loss, and kidney failure. And it's especially prevalent in our audience, which is people working non-standard work schedules, and they're at a higher risk for blood pressure, kind of altogether.
So moving on to our target audience, we decided, at least as a launch neighborhood from our research, that we're going to focus on the Tioga Nicetown section of the city. The age range we're going to focus on is 35 to 55. And this population identifies as African American and has high blood pressure. We came to this conclusion because 44% of Philadelphians are African American, and this is higher than any other race. So we can go. And where they work these unstandard hours. Again, this is where our focus comes from. And this includes night shifts, weekends, and the occupations that we started to think about a little bit, but are not limited to: food service and retail, house cleaners, janitorial services, warehouse workers, and hospital staff. And this group has a low level of health literacy and could have difficulty or are maybe reluctant about managing their disease. And this group also has they want to learn more about managing their disease.
Our stakeholders. So some of our stakeholders are dependents, so that would be children, if they have elderly parents, things like that, that depend on their income, but also their helping of them with health and all of that stuff. Their employers, that's really important too. To reach out to the employers just because that's who will be interacting with them the most with their unstandard hours. Healthcare providers, since we are focused on high blood pressure, it has a lot to do with their healthcare providers. Unstandard hours makes it more difficult for them to be at the doctor's offices, things like that. Government agents, so that includes beneficiaries, medical insurance agents, and things of that, as well as if they're on benefits or disability. The American Heart Association is something that is a stakeholder, but we also want to work closely with through the project, as well as SHARE, which is a food bank in Philadelphia. And also community centers are really important, especially in Philadelphia. There's a lot of centers for different people that we can really target because it's something that they're already going to, or if they're not already going to, their kids are, or their friends and their family, their neighbors. And then also convenience stores and supermarkets. A lot of the concern lies within their unhealthy eating habits. So we would target the stakeholder of the supermarkets and convenience stores to have a more healthy option for them. And lastly, child care services. A lot of the people that we're targeting have young kids or kids that need help during the day when their parents are asleep and at night when they're at work. So we would also want to incorporate them in the process of this as well.
So for our communication objectives, we intend to support our audience and help them understand their disease is manageable even in their environment. And we want them to feel in control of their health and empowered to make better decisions in regards to it, because they might not be currently, especially they might feel a little trapped in their situation and that there's not a lot that they can do. So we want them to be empowered to do more for themselves.
So some potential obstacles we thought of when doing our research is potentially a hesitation with our audience to trust an outside company or organization with anything that's related to their health and not directly provided by their doctors. We also noticed that they might not be excited or willing to take time out of their already limited spare time because, again, if they're not at work, they're asleep. If they're not asleep, they're at work. And they also may potentially require an advocate to come with them to appointments. So that's another thing we have to take consideration of. Oh, that's me as well. So for research strategy, we started off conducting preliminary research on the demographics of Philadelphians and the health problems that their residents face. Then we branched off into how might we statements. We then organized them into category and found 3 main subjects. So we were between people who work non-standard work hours, asthma in non-English speaking Philadelphia children, and HIV comprehension in non-English speaking populations. But we decided to focus on non-standard work shifts because it was kind of a topic that we've all or most of us have had experience with, if not personally, familially. And that's how we came to our conclusion. Questions that we've decided to focus on are what factors are contributing to the high rates of blood pressure in our target audience? What are small interventions that can help manage high blood pressure? And how do we meet the target audience where they are in relation to managing their high blood pressure? Tone and style words was Dylan, I believe.
So the first tone and style word that we thought of was refined. When we were thinking about this, we originally kind of came to the idea of this higher class approach, but I think we kind of honed down on refined a little bit more because refined is a little bit more, it's still elevated and high end feeling, but I feel like it's more accessible. Relatable because we don't want to create anything that could go over people's heads, or again relating to accessibility, that they feel it's something they can relate to and can have access to. Accessibility, that's kind of what leads to that. And friendly, because I think health issues are such a touchy feely subject that I think that if you approach this in some sort of way that could seem negative or pushy or not friendly and open, we could really start to scare away our audience. So we thought that was important.
So a little bit about our schedule. So right now, we are on the first week of October. So we're starting to think about execution, ethnographics. We're doing research and interviews, as well as starting to think more about the creative strategy, what we want to do, what we want the feel of the project to look like. So we have this timeline to kind of go off of. So right now we're doing the concept presentation. So from here, we're going to focus in on our group. We're going to do research on areas that we are looking into. And then from there, execution, testing, our final presentation, and then the end of the project. We're going to continue doing research throughout the entire project. There's always growth that we can go from. So that's kind of our goal for our timeline, is to consistently keep doing research and keep reaching out to these groups and really finding people that we're targeting to help us with our better understanding.
So for our future implications of this project, we're aiming to create a lasting impact on the health of those in our target audience. And at this current point in time, they have a variety of factors. Oh, that's okay. No, you can go. That contribute to their poor health literacy, and as a result, they have poor health outcomes. So with this high blood pressure is a particular area of their health that's suffering, and it's also a factor for other serious health problems such as stroke. So this project, will help to the population to better understand the factors that contribute to their high blood pressure and how to manage it. So provide resources to them that they're lacking, better help themselves do that. And by doing that, we hope to create a community that is better equipped to manage their health and passes that ability on from generation to generation, creating better long-term health in the community. The insights that we'll gain from this project that'll help us as designers is to better understand the research process and how to create effective solutions to real-world problems. And the insights may also help us with similar projects in the future or just people in general with similar projects in the future by providing a successful example of how to increase health literacy. And here's our resources.
Yeah, exactly. Mic drop. What a clever approach. I guess we looked at each other and went, "Oh, like what a topic." Because I think even I feel like I never really thought of it. I will be honest. It's really cool. And actually, I do know that our night workers, our off day shift workers, are at risk of some significant health issues for no other reason than when you start messing with circadian rhythms, our body really doesn't like that. So I think it's just such a unique and really neat area to address. I'm just like, whoa. I think I wrote down a name of someone. I need to follow up with one of my friends who does work work hardening to see if she knows anybody who might be able to help you out. I don't think she does this particularly because she's very much in a hand clinic, but she might have a friend. I don't know. So I make no promises on that one. But the first thought that came to my mind is that factories in these places will have occupational health. That's what it's called. They'll have ergonomics, the divisions too, especially for the big factory. There's going to be people hopefully at these places that they might be doing stuff already because it's a known issue that night shift and late night and these weird schedules can actually really, really hurt you. And so it might be worth investigating some of those resources and finding out write that down, to see what's already being done. I have no idea, but it's worth finding out. I'd be surprised if they weren't doing something. But definitely have the high blood pressure, and like you said, it has to be friendly, approachable. Like the issues with the physicians that you're talking about, like not being able to get out to your physicians, because I had a sister who worked night shift as a nurse. It's impossible to get up on time for appointments, depending on what time of day it is. It gets really hard really quickly, and it can really mess you up. So I think you guys are seeing the whole problem. It's really, this is just such a cool idea.
Great. I think a strength that I saw was the fact that you're considering sort of this topic as a feedback loop, where you want to have a positive feedback loop where it's like, hey, we're going to find a way to engage this in this very unique opportunity, but we're going to try to think of our design implication as it's going to continue to improve upon itself in future generations, paying it forward to their children. And so I think, again, as designers and as healthcare providers, like we can go in and put a Band-Aid on the issue at hand, but are we really thinking about what that, is this Band-Aid equipped to, work time and again?
This is definitely a very systemic issue.
Yeah.
A much bigger, it's a very big problem.
She said it's a big problem.
Do you all have any questions? Okay.
Oh yeah, picture.
Beth's got her camera. Pictures all around. Carly's listening to you guys. She said that this is my group. Great job.
Oh yeah.
Carly is on listening.
Reach out to her.
I'm telling her that this is such an awesome idea, even though she's heard me say it already.
Bye, guys.
Bye, guys.
Have fun. See you later.
You wave at the camera and say bye to Carly.
Bye.
That is such a cool idea.
That group's really good. Wow. It's in the group to see. My first time. I had a little too much other things going on in my brain.
So, sorry, a little bit of orientation as we get you guys here.
Oh.
And you are going to need to pass this microphone, but this microphone is also very sensitive.
It is. I clip it onto myself.
Well,
I can do it and do this. We have so many things in our
but we don't. We want to try not to let the antenna get buried in your clothing or
okay,
bent.
that's what I think I just did that. Now it's working. That's, no, I'm gonna just go like this.
Oh.
Just you stand on the other side of me. I think someone stand on this side of me so I can go like this when you're speaking.
Yeah, I'm first.
Appreciate you.
Oh, cool. Oh, really?
Yeah. That's why we're.
And we can see our
One of the
sides.
students is on, the other ones are kind of been popping in and out, and so share it on Slack for the rest of them. Cool. Scared. So we'll go.
Will you just click next to make sure that is perfect? Oh, yes. All right.
Yes. Okay.
All right. Everyone, our topic that we chose to look into is child trauma. I'm Ruby Nathanson.
I'm Emily Williams.
And I'm Cheyenne Fowler.
Oh.
So as you may know, health literacy is the degree to which individuals have the capacity to obtain, process, and understand basic health information and services needed to make appropriate health decisions. So when studying demographics of Philadelphia, it was apparent that increased dropout rates in school were linked to trauma and poverty. Children who experience trauma may have stunted mental and emotional growth. With this knowledge, we became interested in the prevention and education of childhood trauma.
So so we looked at a map. Through our research, we realized and noticed areas within the city higher percentage of poverty than others. Allows us to pick that we would like to work closely the darker areas of the map.
And so we did some research on some personal voices and some quotes as well, and we found a couple, and actually a lot. And this one that really stood out to us was that children experiencing this type of toxic stress are unable to access the executive functioning area of the brain. Without access to the cortex, children have difficulty or are unable to learn in the same way.
And just a quick stat, so 42,000 children and adolescents in Philadelphia experience mental health problems each year.
And so the task analysis basically is an overview of our timeline of our project. So right now, we just finished the discovery phase. We analyzed and understood what our problem is, and now we would be moving into define and then develop and deliver.
So also have was pretty interesting. Said that, so that was really interesting to us as well.
So then we started to talk about our target audience and stakeholders. This was how we started. We started with our stakeholder map, where we identified different people in children's lives, whether that be in or out of school. We focused on the comparison of amount of power a person has in a child's life versus the amount of interest or knowledge a person has about childhood trauma.
So we made even a more extensive stakeholder map. This specific within the category as well.
did was when doing our studies, we came across Stephen Hymans, who is a guidance counselor at Barrett Middle School for 18 years. He is surrounded by students on a daily basis, and he has witnessed children suffering from trauma and neglect. He has noticed many students suffering from hypervigilance, which is generally experienced from people suffering from PTSD. He has been known to be pushing administration and teachers to be educated on identifying a child's experiencing trauma. There we go.
So our communication objective, why are we talking to our stakeholders? For the purpose of getting to the problem as we can. If it's not targeted at the children themselves, we want to address the outside stakeholders to find a solution to this issue. And we want children to ultimately get connected to resources that will help them. And this could also be something they'll remember forever and have with them through school as well.
So for possible obstacles we may approach when doing our studies, this is what we might run into. Okay. So we might have the audience that we're addressing may have a lack of funds to receive the proper care. They may also lack interest or the need for addressing the issue. They may not see a mental health education as important. A lack of care for the school system, a lack of care from guidance counselors, whether that be in school or not, and a lack of time by parents or lack of care for the issue.
So we're going to talk about the research strategy. We did see earlier the task analysis, which is more of a timeline of the whole discovery and research phase. But now we're going to go into the logic model, which is the methods of how we're going to implement it. And so with our logic model, we did just finish the literature review where we did realize where we need to do our research. So we looked at NGOs, we looked at local journals and websites. We also looked at a lot of magazines because they did do a lot of articles based on the childhood trauma and mental health of Philadelphia. And so after we overviewed that, we now are able to understand the entire problem and the people who are affected. So now, right now, we are getting ready to go into the ethnographic research, interviews, and research summary. We have established our contacts. We have reached out to the director of childhood trauma services on campus. And also, we do know some students who are part-time teachers or volunteers teachers in local elementary schools in Philadelphia. So we're able to connect with them as well to see any early stages of childhood trauma if they have seen anything. Obviously, taking into consideration HIPAA and not going into the children's lives and interviewing them, because that is going to go against privacy.
So then we went later to our how might we matrix. This was when we were researching, we decided to tackle the questions of how can we better bridge the gap between areas and mental health resources for children? How can we help children better understand emotions? And how can we create a safe
defining the problem, more research, interviews, which we're going to have. We actually set that up. Yeah. Yes, yeah. That's that based that bring.
And we have the questions you may have.
Thanks.
I'm all hooked up. You're all hooked. It's getting pickier and pickier. All right, so yeah, so you guys already found Steve. So that's awesome. Because I was say, oh, I know I can hook you up with someone in CTC, but you're already 3 steps ahead of me. I know he's gonna haven't met him yet. I would say he's amazing and awesome and wonderful for you guys. There's a couple, was an OT or two that I actually know who might also, actually the one I'm thinking of, which she's out in California now, so I need to email her and see if she would be okay to answer some questions. But I know that she and Steve and Jean Felter from CTC were like this tight. So yeah, and I'll see if there's someone in the department who still kind of has the sling, but Michelle comes to mind because this was what she did with CTC. So I will try to connect you guys or find someone else also, because this is a huge topic in my field as well, because like you noted that the trauma, it plays a huge role in development and all sorts of things. I'm kind of curious to know, just food for thought, like on top of addressing the trauma and the effects, but also I think where it ends up going in my field is addressing childhood mental health, especially in schools. And so that might be another, like it's the same issue, but just like a slightly different side of the coin that you might want to consider also addressing in some way. Because yeah, it's very, very, very timely. And I think one thing you'll find from Steve is that trauma ranges everything from just, he'll talk about the ACEs scale, and I'm making a note here to your OT student to share the ACEs scale with your group. But it's basically like a assessment that we do to log childhood trauma. It's everything from poverty to, do you have a family that's been divorced? Like there's all of these different things that can happen, and it's sort of an objective way to see the risk for potential childhood trauma issues.
Can you, I mean, they're going to talk to people who are more knowledgeable than me, obviously, but is childhood trauma as a topic, do you see that as being too big? Do you think that they'll have to focus in on a specific type of trauma, or is it just like by finding a location, like intervention at schools? Do you think that
Like what's gonna happen? Like, is it too big of a topic?
Yeah.
Like what I see happening in the research, just from walking around conference, is that they'll say childhood trauma because it's kind of a buzzword, quite honestly. But then it is very not so much population specific, but setting specific, and it tends in my field to run really more around school-based therapy because that's where most of my colleagues who are in that area end up practicing. Not to say that you wouldn't have childhood trauma clinic in like at CHOP or somewhere else. So I think you might find that, I think we even treat it pretty broadly, but it also is dependent on where you actually work. So I know like Steve does a lot of community-based stuff. I know he also works in the hospitals. So he might talk on those areas a little bit more. I don't know what he's gonna talk about, quite honestly, but I know that's where he has been. Whereas like the OT that I'm thinking of, she worked with them at a school down the street. So I actually really don't know what your research is going to find, because it's kind of a newer thing, and by newer I mean it's been around maybe 5, 6, 10 years at most. So we're still also learning a lot about it ourselves. So I think it's not terribly broad, but I think you might end up wanting to pick a setting because that's just where practice is right now. And there are very specific considerations for the school versus a community-based clinic versus a hospital setting, because even just being in a hospital, that's, you know, you're going through chemo and cancer, childhood cancer, that's traumatic. So there's very different flavors, I guess, of what we're looking at. But it's a great topic, very, very timely, because mental health is so important for our kids. Oh, we have someone online, and she wants to know if you guys know about the public health tier system. Okay. So that'll be something to look into, like the different tier, I think it's different levels of intervention, like tier 1, tier 2, tier 3, and like where can we intervene at these different levels. Yeah. Thank you, Carly, for that.
So yeah, just step on the side so that your heads aren't in the light. As you guys. Did you just get it? No, yeah, that was it.
You're evil.
I'm gonna take a, and then I'm Is this for your Christmas card?
Oh, we have one. Oh yeah, we We just have to crop Sarah out of it.
Yeah.
Thank you.
Thank you. Thank you. Appreciate it.
Thank you all. Carly's our MVP. Are we ahead of schedule now? A couple minutes? I guess so. Look at us.
Michelle, like, childhood trauma was a thing. I don't know if any faculty were that's thing.
That's their like
To the level where she was like, that is what she did. You know?
I feel a little like I need to go do some of my own research to help them because in my mind I was like, what about childhood trauma? Like childhood trauma could be like so many things.
Yeah.
And so I got nervous that it was too broad. Yeah. And then they sort of talked about mental health and I was like, well, I guess that's sort of like narrowing it down, but only a tiny increment. Cause I was like, I don't know. I just take it to the worst, darkest place where I'm like sexual abuse or I don't know.
Because I don't know how.
Hi guys.
One day.
No. You have your presentation on Google Slides?
Yes.
Cool. So I'm gonna have you log in on this computer.
More.
And there's a clicker. So we've got a couple like props for you. There's a clicker, and then when you start talking, you have to tap the microphone. Okay. Because we've got OT people listening in from a Zoom. And you gotta make sure you stand close to the screen together. Oh, he's got the clicker. Oh. All right, so you guys have to stay closer to the screen. Yep. So that we can it's like a boy band. I know.
I didn't realize what's going on.
Okay. Oh, sorry, I walked off.
So it's very testy right now. The Bluetooth is not, I don't think, I just reset it, but I don't think the Bluetooth wants to behave.
But just be careful not to bend the antenna and don't mess with the cord too much. Basically be nice to it.
And it needs to be holding on.
Gentle.
Yeah, it needs gentle.
All right, how close should I?
That's good. Yeah, that's right there.
All right, yeah, that's perfect. All right, I'll try my best. Okay, good morning, guys. And we are Team 1. My name is Arthur.
I'm Sarah.
I'm Zach. So our project, Health Literacy, started with, I can't really hold my notes this way. Appreciate that. So our project started with just a general brainstorm of all the potential health literacy issues. We did it in class with all the participants, being the students. And then we utilized the affiliative clustering technique to form 3 major groups. And we organized all the issues into 3 major groups. And the one that we decided to focus on is information awareness, which means that our study group chose to focus on the health literacy issues that arise from absence, poor execution, or distribution of healthcare information. So, this is our hopes and fears as we started the project. Our main hopes are to acquire knowledge on the topic of health literacy successfully, collaborate with the occupational therapy students and faculty, and hopefully we can execute the project according to the guidelines. Our biggest fears are poor time management, because most of the people in our group are working, so time is a very, yes, big issue. Lack of data necessary for secondary research. And the last one is a technical issue with college equipment.
So what we did was we started to look into like different health information awareness in SEPTA itself. So the biggest thing we found out was that there are definitely issues within the SEPTA system. So we want to kind of pinpoint those through secondary research.
So our problem statement deals with the accessibility and ethics issues on board SEPTA vehicles.
Next, we're just going to go over like a little overview of transportation statistics that we found through secondary research.
Technical difficulties with college equipment.
There you go.
What is this? A slide?
Yeah.
Yep, it's a regular slide.
Okay, so I don't need the slide to tell you what it is. It's kind of a little story that I found through my research with a SEPTA bus issue that there was on the 42nd line on Chestnut Street, I think it was. Walnut Street. There was a incident in the winter when it was snowing out where there was a pretty crowded bus and the bus driver pulled over, stopped at the stop, and there was a handicapped lady, an older elderly lady on the side of the road in a wheelchair. So the bus driver got off the bus, got everything prepared to get the elderly lady on the bus in the wheelchair, got her on, and then there was somebody sitting in the wheelchair accessible area. And the only steps the bus driver has to try and prevent that is to ask them nicely to move. So he did, and they wouldn't get up. They ignored all of his suggestions of moving to a different seat. So the bus driver then had to unload the elderly lady off the bus back into the snow and then drive away. So that's just an issue that we came across where the ADA laws that are in place right now don't allow the bus driver to actually make them move. All they can do is suggest that they move.
We also looked into socioeconomic statistics of the SEPTA riders and commuters. And it actually helped us realize a couple of things. The first thing was that the higher paying jobs are usually located within the inner city district, and the lower paying jobs, I mean the jobs with salaries less than $40,000, are usually scattered in the Philadelphia region. On the other hand, people who make less than $25,000 a year are the ones who travel the most, which means they are the ones who have to sometimes even transfer twice to different vehicles, which makes their commute more expensive. Who work the higher end job commute. And as well of areas that have poor transportation and accessibility, and looks like that the North Philadelphia, as well as the struggling neighborhoods, are actually the ones who are also affected by poor accessibility and to transportation.
So yeah, just a little more general knowledge. In Philadelphia, the average commute time is around 31 minutes. Figured actually take into account transfers from different types of transportation. And it also doesn't take into account the amount it costs having to take multiple modes of transportation to get to a location. But then I also looked at figures of the different types of commuter transportation. So the highest number is actually people who drove alone, which I found surprising, but we're focusing more on the public transit aspect of it. One of the resources we found during our research was from Oregon, the Federal Transit Administration. This speaks about accessibilities in multiple forms for those of English proficiency, also offers some areas of research and focus, very detailed lists of where to look, who to talk to, stuff like that.
So the next step in our process was to create a problem tree analysis where we laid out like the central issue as ethics and accessibility on SEPTA. And we started with creating some routes, which were along the lines of language barriers, people with disabilities, where do they go, what kind of life routines do they have, people with low moral compasses that ride public transportation, which seemed to be an issue if you can tell from the story, the guy that wouldn't get up. Low education among people, lack of public funding, lack of accessible seats, which seems to be another problem on buses. There doesn't seem to be enough seats sometimes. And then also the ADA laws, which for those, they created different cause or effects from the problems, which would be our branches on the tree. People were missed work or late for work. That affected their ability to keep their job and perform their job on a daily basis. People getting offended because people are not quite very nice on public transit. As I'm sure if you've ever ridden a train or a bus, you've noticed people are rude. They're rude in general on public transit. Also, mobility of wheelchairs users and how they get on the bus and off the bus. It's a process. It takes a little while. It's not that it disrupts the bus, but somebody that's on the bus that wants to just get to work, that might be an issue for them. But then there's nothing you can do about it. They have to get on the bus to ride public transit. So the next thing we found was through some research, we found a guy named Charles Horton Jr., who is the Executive Director of Accessibility Compliance with the Mayor's Commission on People with Disabilities. So he works with SEPTA, he works with different areas around the city to create more accessibility like pinpoints and try and pinpoint issues and work with the councils to fix them and create laws that will help people. He's also the ADA coordinator in Philadelphia. I'm sure you know who he is.
Actually, no.
Really?
I don't know him.
He's an interesting guy. He's actually a wheelchair user himself.
Yeah.
Yep. Yeah.
So looking at another resource on SEPTA's web, we found out that they have the SEPTA Advisory Committee. This committee meets quarterly. We actually just missed the meeting by like a week, I think. And they look, it's open to the public. But there is a accessibility SEPTA email that we are attempting to get in contact with. They look into accessibility issues with equipment, facilities, or services. And then there's a detailed list of that list says the majority of the stuff, but they are willing to talk about any issue of accessibility.
So next thing.
I wanted to mention one more resource that we actually reviewed but decided not to include. That was the initiative started by City of Philadelphia, and it's called Connect. And it's a strategy set to improve the general infrastructure as well as the public transportation in the city. However, within their strategy, it doesn't really talk anything about accessibility, which I found to be interesting, because there is an initiative to reduce or to completely have a zero accidents within 2 decades. Another initiative to build a better infrastructure and add bicycle paths, but somehow they overlooked and didn't really look into accessibility.
So the next step in our process was to create how might we statements, and we came up with a list of about 10 different ones, actually a little bit more than that. We narrowed it down to 3 that we really wanted to focus on. That being 1, to work with the younger population in Philadelphia that rides public transit and kind of just create a discussion on ethics issues and how you should act on public transportation, because we've found some stories and some personal accounts how younger people don't necessarily act the correct way in public, let alone on public transportation. The next one we found was to improve like systems that are currently in place, such as the CCT paratransit, which works with SEPTA themselves on the bus systems. And then another thing we wanted to look at was working with different lawmakers around the city that currently have pull and can work about accessibility issues, not just on SEPTA, but around the city in general, such as like Charles Horton Jr. and guys like him.
Another step that we did during our whole research process was to map out all the stakeholders or the primary stakeholders and to understand if there's any overlaps between the stakeholders, and because we thought that those can be valuable connects that we can extract.
So that kind of led us to creating this creative matrix type thing where we started with our stakeholders across the top row, and then different kinds of like creative ideas that we could come across to create a different program that would work towards the goal of creating better accessibility on SEPTA and in the city in general.
So from that, we actually clustered some of the more potent ideas. We came to some concept ideation. We thought that using Philadelphia sports mascots in collaboration with discussing ethics on public transportation would really grab the eyes of not only those who are younger, but also those who like sports, anything, just a way to connect with the people of Philadelphia. Another idea was physical messaging on seats and around seats on SEPTA buses and trains to expand the knowledge about accessibility, whether that be using different colors or anything to really notify people this seat is handicapped. And then a point of contact, identity, and information system. So where we came to this concept was actually something that in all of Disney's properties, they actually have on their name badges, it not only says where they're from, but it also says like they're certified in CPR, or they speak Spanish, maybe they speak Russian, like any type of point that could help them communicate with someone communicate with someone in need.
That includes the bus drivers.
Yeah. Yeah.
Which is a huge thing down there. If you've ever been to the resort itself, you stay on the resort, you can take a bus anywhere. So all the bus drivers, it's kind of like a SEPTA bus system where the bus drivers have the name tag, and it tells you, like if you get on a bus and you don't know where that bus is going, you can ask them.
And they always have, if they don't know the answer, they're always in contact with someone who knows the answer in like 2 seconds. Yeah.
And Disney's kind of like the hub where people from all around the world go. So we kind of thought that was the same thing because Philadelphia has people from all around the world. It's a very diversified city. So it kind of relates to that right there.
Yeah. And one of where that concept came from, Disney actually has a book on the service industry, since they're one of the top in service. It's called Be Our Guest. That not only talks about like service in the restaurants, it talks about service in every form, whether that be helping someone with a handicap, helping someone who does not speak English, all that information. I'm actually getting that book shipped to me at the moment. I thought I had a copy.
Yeah, so I mean, if you guys have any questions.
I have in my email from 2 days ago. Hello, Ms. Cheryl. My name is Will Herzog. I'm the chair of the SEPTA Youth Advisory Council, YAC. I hope this message finds you well. I'm writing in hopes that you'll be willing to pass along a position for a wayfinding designer at SEPTA to the right folks. We should get you in contact. When you said you have the youth focus, again, maybe this could lead to a job someday, but he might be a really brilliant resource within the SEPTA system, and they have actually been turning a lot of their attention. There are a few designers in Philly who, on their own accord, sort of did an analysis and a redesign of how they could make the SEPTA experience better and post it online. I'll try to find the link or the name of that. And while SEPTA didn't engage with that particular firm, they did take on a huge initiative to make a more seamless process for riders. So again, kind of serendipitous in the presentation.
Right. I have another contact at SEPTA, especially if you're having a hard time getting a hold of the accessibility division. There are now 2 OTs who work there. They're the first OTs that I've ever worked at SEPTA. They started a couple of years ago. It was a grant-funded project that basically they've saved SEPTA millions. They are extremely good friends of mine. So I can connect you with Amy and Catherine, and they hang out in the accessible transit section. It's under suburban. They do transit training, which is actually teaching people how to use public transportation, like kids with disabilities, older adults, anyone who's having any trouble using it. Part of it is educating about their rights, because actually there's ADA guidelines, but it's not really common knowledge of what your rights are on public transportation. Yeah, and then they also do the screens for the paratransit. So they're one of the steps you have to go through to be eligible for paratransit. So I will connect you to Amy and Catherine. I know they'll talk to you because they love their job and they're pretty awesome. And then they have all sorts of stuff down there. One thing that was coming to my head too, on top of just ethics in public transit, because I heard a couple ideas coming out. I don't know which way you want to go, if you want to hit up the kids and teaching them how to use public transportation ethically. And I think I really had this vision of Gritty just coming and smacking someone out of a chair.
Well, you guys have a really awesome vision of how that could work.
Yeah, I know, right?
Did you talk about performance stuff?
Yeah.
But so it would teach people how, they would have little interactions that would teach, how you're supposed to behave or whatever.
Yeah, the stage interactions would be funny. But the other thing I was hearing too was maybe, I think you guys weren't really touching on it heavily, but you're kind of poking it, of whether or not people know their own ADA rights on public transportation, because not everyone who uses it goes through Amy and Catherine. You don't have to go through Amy and Catherine necessarily. So that might also be an interesting thing. I don't know.
Or maybe second and third, but
Yeah.
That second one was much more about just getting all that knowledge out there.
Right. They don't know what they can do or what they're allowed to do. We did do a program for SEPTA a couple of years ago in my program development course, which was a bus driver training on accessibility and how to interact with people with disabilities. And I know Amy and Catherine were fixing it up, and hopefully they were working on getting it implemented. So
I actually mentioned that in our create something along those lines, having the drivers be trained.
Having the drivers be trained, yeah.
Yeah, that was one of the things we talked about.
Yeah, so that's something that we've kind of started addressing.
I think you guys, maybe in class, you just go get on the train, go get on the bus. Ethnographic research, you have to be careful when you take photos or ethnographic photos. Well, I think help me because I think about when I ride the train downtown, that if there is someone on a wheelchair, they have to get out. They have this huge metal ramp on the bottom of the train station, and it's where the train, everything employee, I don't know what their official title is called. Not conductor, but the driver.
Yeah.
You have to have substantial strength to get that set up.
Oh yeah.
So again, I think you can learn a lot just by being the fly on the wall. You've got $250 to your name to spend on this, so take some of that cash, pay for some public transportation trips.
And I know Amy and Catherine also have a mock bus in their things. They actually have a mock station down in there to train on. So if you want, on top of, you should definitely do it in real context. Absolutely 100%. But you might actually be able to touch the stuff,
That's interesting.
Yeah, you guys have you got way too many resources almost at your disposal. What are you going to do with it? I love the idea.
Yeah, there's too many good ideas.
We are going to have to cut them off. It's great because you're right. It is a huge problem. And between the ethics alone of people knowing that, hey, you should get your butt up off that seat, and other people knowing their own ADA rights, and then just everything else it takes on the bus driver side, even it's a job. It's just different things there too. And I think there's actually an accessibility hotline. I know Catherine, she's very proud of the fact that anytime she sees a violation, she reports it on the reporting system. So there is a reporting system. Yeah. Yeah, pretty much. But it gets stuff done because SEPTA does take it very seriously. That part's very accurate. They take accessibility very seriously.
Yeah, and it's such a hot topic right now. The person that they mentioned, since they've mentioned him, I've heard him on the news several times, on NPR and my morning ride here. I'm oh wow, this is really interesting stuff happening. So,
right. We're actually going down to SEPTA end of November as a class. So
Hop on that train.
Yeah, hop on down and join us. You can see at least what OTs do within SEPTA, but that's end of November. I'll connect you to Amy and Catherine sooner than that. Cool. Good job, guys.
Together as a group. But so I just want you to stand off to the side of the screen so that your heads aren't. Yellow might wash you out, but you guys chose it. 1, 2, 3. 1, 2, 3. One more. Such like good posture. I know. All right. All right. Thank you guys. Bye.
Probably made a good point. She was saying, out of curiosity, it sounds like much of the accessibility stuff is geared toward physical disability. Is there any kind of sensory sensitive problem solving? Like sensory integration, sensory
You know,
sensitivity.
we did
and
talk
I was
about
just,
that actually in their creative matrix.
Yeah.
There were so many things that
There's so much.
that came up with this because these guys have been working really hard to like
really good
understand their issue. Really, like they've been like so at the research because one of them, Arthur, actually kind of questions. He's like one of those people who questions every Ukraine.
Okay, that's right.
Yeah, and he's like questioning everything, so it's made them do so
Yeah.
much.
My comment to
extra
her is
thinking
that
like,
Amy and Catherine do
but in a
address
good
it
way.
in
In a good
transit.
way. It's been great. I mean,
Yeah.
like.
Yeah,
Hi,
Amy
guys.
and Catherine are, Amy and Catherine
So
address it.
we've got a little orientation
That's
here,
not
but if you want to log in, access your presentation. And then we've got a clicker. You can to advance your slides.
Oh yeah, first service.
And as you talk, here's your charge.
What?
You're going to hold this in front of the person speaking.
Okay. It's a mic.
Yeah, but it's kind of sensitive. So not like you don't have to have it like here, but like
Yeah.
just general vicinity.
I worked in the tech in high school, and this is what we did. Yeah.
You
don't-
can clip it, but then when you have to like hand it
Right.
off,
Yeah.
it's kind of like, yeah.
Oh, you want to take? Oh yeah. Yeah.
Sorry, it's not you. It's this thing that sucks. I'm gonna make you hold it.
Okay,
Because like
okay.
it
Okay.
kind of-
I'll
it's
just
kind of-
hold it.
Yeah.
Just because holding.
When you present, we need you to stand closer to the screen so that OT people can see.
Oh, I see. I see. Okay.
So they see your
That doesn't make it.
They just
anymore.
see a little bit of you, so don't.
Oh. Okay, I understand. Yeah.
I'm gonna snap some photos along the way. Don't leave it distracted. And then whenever you're ready. All right.
Okay, so this is our research process. I'm Eli. Jack. So health literacy is the ability to understand basic health, what you need to do, stay healthy, and improve your life. And when you have good health literacy, you are able to make appropriate decisions based on your personal health. Mental health is what our focus is going to be on, which is a person's condition with regard to their psychological well-being, basically the state of health. Some of the issues in mental health are anxiety, depression, ADHD, Asperger's, OCD. They're more mental issues, are the ones that we kind of when we started, we were thinking about learning disability. We were also wanted to focus on alternative solutions other than like Adderall, Ritalin, and other medications that seem to be the norm. So we thought of things like CBD oils, and then nutrition. We found a lot of research supporting that nutrition affects your mental state. And since we are college students, we wanted to focus on college students. As we did more research, we realized that college students may not be the best area because they have a higher literacy level and they understand what's going on, even though that their mental health isn't the best and their nutrition isn't the best. They know enough to know why and how to fix that. So we decided to turn on a younger section of the city with lower income. Yes, what we realized is that mental health issues within Philadelphia are worse in the areas that have lower income, and there have been efforts in the past, but it seems to only have gotten worse and has gone up 20% since 2016. And the main issue with most of this and mental health, any kind of no effort towards supporting mental health or understanding issues that their child or the kid themselves might have. And then with that, then even the ones who do know, they don't know what to do about it. They don't understand treatment. They might not have money for treatment, or they might just not want to put their kids on drugs and don't know any alternative method of helping their child. This is the cycle that creates this mental health issue as well as education issue. It starts with, well, where it starts is to be debated, but the low income, Philadelphia's median income is about 40,000 as compared to the state's overall 60,000. And there are areas of the city that we focus on that are even as low as 27,000. So that translates into poor schooling. Philadelphia is 92nd in education out of the 100 largest cities. So that's not good. And that both the low income and poor schooling results in mental health issues and low school performance. You are 21% more likely to have anxiety disorders and 39% more likely to have mood disorders if you live in the city. And 1 in 4 Philadelphians drop out of high school before graduating. And there's a lot of information that supports that this downward curve starts in around 3rd grade. It's when they start falling back. And then from there, they never catch up.
Okay. So where we're going now, we realize that both parents and children do not fully understand what mental health is, how to notice the symptoms or how to help, and we'd like to teach children ages 9 to 14 and their parents how to recognize and cope with these emotions and how and where to get help. So inner city, our problem statement, inner city children and parents have a low understanding of mental health. This results in students becoming separated from their peers and not getting appropriate treatment. And both of these result in low literacy and a high dropout rate, which contributes to low income levels. Now our research, the facts. Persona 1. One of our personas, child Seth, age 10, grade 4. Seth is a student at Stephen Decatur School. It is his first year, has few friends and trouble making new friends. His lack of focus makes it hard for him to excel in school, and he is insecure about how different he feels compared to the other students in class. And then persona 2 are the parents. Sherry, age 36, occupation, food server, manager. Sherry is a single mother with 2 children, ages 9 and 12. She works long hours, does not see her kids as much as she would like to. She knows her younger son has extra energy, which is affecting him in school, but it doesn't know how to help, but would like to learn more.
Okay, so
Within our research, we looked at 4 different schools within the Philadelphia area, and these were all the lower rating schools within the city. So we looked at Stephen Decatur School, James Dobson, Alexander Adair, and Ronhurst. And all of them, because of the age level, are about 50% proficient in reading. So that one wasn't really a variable that we were too worried about. We thought we'd put it in there anyway. But with the income levels, so the 2 opposite ones, James Dobson, Alexander Adair, both have about a 46,000 income in that area, whereas the Stephen Decatur School has 27,000, and the Ronhurst is a little bit higher with 50,000. So that's something that we wanted to take into account when coming up with which one we wanted to focus on. But we're still stuck between 2 schools because we don't know if we want to go in the direction of the low income level in the area or the high diversity rate within the area, because we looked it up in more detail. And for the Stephen Decatur School, as you can see, the green, we looked up the ethnicities and the minorities within the area. So in the whole zip code area of this school district, there's 80% white, and then it's about even with Black African Americans, Hispanic, and then Asian students. And then when you look into the public schools, it gets larger within the Black or African American community within the school, but it's still a large white population overall. But we wanted to focus on this one possibly because of the income level, because it's 27,000. We thought that would have a reason to look into the mental health issue. And then with the other one, the Alexander Adair School, we thought this one was interesting because of how many white citizens and residents are in the area, but then versus the public schools, you can see that they probably get sent out to private schools or charter schools because there's 27% white students in the district, whereas there's almost half of the district is Hispanic, and then with a quarter Black or African American, and then a small percent of Asian students. So yeah, that's where we are now. And we looked up how we wanted to reach our demographics. So we had a lot of ideas that were kind of in between. So one area to focus on would be to make materials for the students to take home to give to their parents. So it would be something for the students and the parents to maybe work on together, or a separate version for each of them. A lot of these students are on the internet because we're focusing on grades 3 to 8th grade. So it's age 9 to 14. And then we also looked at possibilities for working with local hospitals in the area. Maybe they give out handouts and work with the school. Maybe giving a lesson plan to teachers, creating events such as fairs or workshops, poster campaigns within the school, because they all have those posters in the classrooms and the hallways that we could help them see with. And then we also looked into creating games for the students, for maybe the parents and the students and the teachers to work on together. And then for after school curricular activities, we also were looking into that. So we have a lot of deliverable options. Those are our sources. Thank you.
So we're going to have a handoff to the microphone. Looks like Monique is ready to.
Yeah, thanks, guys. I guess my question is, though, really, what are you guys targeting? It's not very, mental health is such a big area. I don't have a good sense of what you're actually thinking of doing, per se.
Well, we wanted to focus on, okay. We wanted to focus on the most popular mental health issues, so anxiety, depression, and then we had a few other ones on the first slide. There it is. Yeah, ADHD, Asperger's, OCD, and bipolar disorder. So we're not focused on one direct thing right now, but we're having options for the most popular ones.
But what are you planning on doing with educating on what they are, or I guess I don't understand your direction.
Educating people to know the symptoms parents to like see if their child has this. So, okay, so to educate people on the symptoms, their brain themselves, as well. It's like other ways that they can help their children, like help them with their mental health issues.
So more of a behavioral approach
Yeah,
versus a pharmaceutical approach.
yeah, exactly.
Okay. So not necessarily tied in specifically to schools either.
No, not necessarily, but that is also like, that would be the takeaway from it, is that your child will do better in school, which will give them a better future.
Okay. A little bit more clear to me now.
To break that cycle
Okay.
by helping this, take that out, they'll do better in school. We'll hopefully get.
And are you planning on addressing like already diagnosed issues?
No.
Or
well, yes, but I feel that the more important is the non-diagnosed, the kids who don't know that they have some kind of mental difference, or the parents who don't know and just don't understand how to deal with that. Many of the parents in these areas don't understand. They don't have the time to spend with their kid to understand that, or they don't understand
why they don't think the way
it at all, or they just don't have the money to, like, I know my kid has ADHD, or I know she's depressed, but I don't have the money to take them to the doctor and do this and deal with it.
okay. Yeah, I think you guys have a very, very big issue then, and you're trying to tackle 6 different things at one time, and that's probably not going to work out so well. Because I hear one thing, which is that helping people be more aware of what the different conditions are and understanding how their kids' brains work. Definitely very valid, definitely an area. We talk a lot about neurodiversity in my field, and just recognizing that even if you don't have a diagnosis, we all run on a spectrum and we all need different things. And you don't even have to have a diagnosis of any of this stuff to just, it's how we are. And then I think within the neurodiversity movement, treating some of these conditions more of just like a different section of the spectrum. That your brain just works differently, and that's cool, and look all the gifts you have. And so that could be one area to go into. If you're really trying to tackle the school and like how to work with these conditions on your brain within school, that's a whole different, like very large can of worms, quite honestly. That's something that school-based OTs have been working on for a bit as well, like helping kids actually be able to learn in the class and helping people understand how their brains work. But then if you go into like behavioral approaches and non-pharmaceutical approaches to help manage these conditions in everyday life, that's yet another big can of worms. So I think you guys need to choose which can of worms you want to tackle, which one you want to open more than anything.
That was kind of a reason for why we haven't honed in on this one yet, which is
right.
Because a lot of the things that we looked at often go hand in hand. And stuff like this also.
Yeah, it's definitely a snowball effect. You're right, and that where if you address one can of worms, you're going to address the other ones. But to actually tackle it as a problem, you're going to have to choose one to go after in order to be really targeted and specific and probably most effective. Otherwise, it's like I kind of felt like your presentation was a little all over the place, which is why I had so many follow-up questions. And I think it seems to be like where you guys are right now, which is cool. But unless you choose an area to really focus on, I think you're going to be stuck in this sort of untargeted area that will ultimately end up not being as effective as you want, despite the extreme relevance and importance of this topic.
What Monique is saying, knowing that you guys have sort of pivoted your direction in the last class, I think that it's really good to hear this feedback. I actually really appreciate this slide in particular in your presentation because it gave me insight as to like you understanding this issue in context of Philadelphia. And it's sort of like, now let's pick one of those 4 categories and sort of like address the mental health issues that you've identified through one of those. And it could be, if we focus on low income, like you just mentioned, like the parents don't have the luxury to really take the time to think about, oh, how could I improve my child's, situation in school and at home, and how can I get the behavioral issues under control? Whereas they're like, all right, here's your dinner, or maybe we don't have dinner tonight, or again, there's a lot of extremes that go into that, but that alone has so many complexities that it would be totally valuable to focus there. Or you could go across the field there and focus on, some sort of like mental health issue awareness on a broader spectrum for like the city of Philadelphia, and maybe you partner with the city of Philadelphia or the education department. There's a million ways to do it, but yeah, right now I really like hearing her insight, because there are a lot of, to use her words, cans of worms that
are all extremely valid projects.
Right.
Just which one do you guys want to do? And that would help, honestly, even focus our recommendations and assistance to you a lot more, because I could go on forever on each can of worm. So, yeah.
We wanted to focus on the education because, like, younger generations. We wanted to focus on the educational part of it because younger generations are affected most by these issues, and at school is where it affects them the most. Yeah.
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 So I don't want to forget that there was a comment that Carly made that's accurate. Asperger's is no longer considered its own diagnosis anymore. It's just part of the autism spectrum. And we'll see it being used because people still claim that label for themselves. But just be aware that as you're talking about professionally, if you use the word Asperger's, know that people say, like, I think Greta Thunberg is a really good example of it. Like, she's claimed that label for herself, but it's no longer considered an official diagnosis anymore.
You just said you wanted to focus on education, right? What was your last comment?
Because it affects that's the age group that is affected most by these mental health issues, and at school is where that's where they're most affected.
Students are at school most of the time, so that's why we wanted to kind of target this one school in particular to help these kids.
Yeah, I think continuing to zero in, like one of the groups that presented a little bit ago, they had a very specific statement about, Renee, I might need your help. It was Niet's group. Yeah, like they're focusing on people who have evening shifts. Yes. For high blood pressure, and it's like so specific. Yeah. I'll just say. Me was that maybe, I don't know if this helps
clarify with your sort of how might we statement or how you focus, but in that first slide where you had like the list of like alternative treatments going way back to the beginning, like the one that had CBD oil on it, yeah, I think like if you can get really specific about like what alternative methods you're using, and then pair it with one of these mental health issues specifically, and do your research, focus that research really tight in on those two factors. I think, yeah, the combination of two things, like what is,
these are examples of very specific approaches.
right?
You can figure out what that specific approach is for your new direction.
Yeah.
Two best ways to go, but would be like anxiety and depression on like a behavioral level, like just talking and therapy kind of deal, or ADHD and nutrition.
Yeah.
Because I feel that
right, because there's
sugar
yeah.
levels and things like that have a high
That's huge. I mean, I just happen to know a lot about that because of having children and being in parent networks and things like that. That there's a huge dietary like thing right now with the that particular problem, ADHD. So yeah, really.
You guys have a lot of really cool avenues to go in. It's gonna be hard to choose one, I think, because they're all really valid and really fantastic. You got a big decision ahead of you, is all I can say. Yeah, because I mean, honestly, I would end up giving you a small novel of places to go right now, and I think that would just bog everyone down even more. Okay, thank you.
Thank you, Carly. DC telling me what the sound is doing.